Hey there, it's Dr. Jim. Thanks for stopping back for more education and information during this COVID 19 outbreak. What I'd like to focus on is self care for healthcare professionals during the outbreak. Because during the coronavirus outbreak, healthcare professionals put in long hours at work. They delivered very high quality care and services, and they kept their patients, their clients, and their residents in senior care healthy and safe. Now that we're experiencing this national crisis and global epidemic, the challenges for providing care to already compromised individuals are far greater. In order for caregivers and providers in healthcare to keep up the pace of this high demand for good quality care, they have to engage in very serious, mindful, and routine self-care. This is about taking care of yourself, healthcare professional. Otherwise, their own physical and emotional health may significantly suffer, and we don't want that to occur. Why would healthcare professionals not take care of themselves? Well, I know, it's fairly well known that healthcare professionals tend to take care of everybody except themselves. Nurses and doctors, therapists and social workers, psychologists and psychiatrists. Might as well pretty much lump them all together here. They are individuals who have certain characteristics and qualities and personalities. And number one, they are other-oriented. First and foremost, these healthcare professionals aren't being focused on others for no good reason. They belong to a group called healthcare professionals, mental health care professionals, medical experts, and they have a very strong sense of self-service orientation and putting the patient first. They also may simply not have the time to think about self-care. They may be so involved in the care of other people that they fail to acknowledge or recognize their own signs or symptoms or sometimes not so healthy habits. There is denial, right? We all deny every now and then. Healthcare professionals may actually be very well in tune with their state of physical and mental health. Some others may ignore it. Others deny that they have any health problems, emotional problems, mental problems, whatever the case is, and they keep it to themselves out of fear that their colleagues may think less of them. And there still is this little bit of a stigma that you should be Superman or Superwoman. There are heroic healthcare professionals and providers out there who don't want to stay home. They don't want to be removed from their duties due to illness. They may live with the stress and the anxiety, depression, pain, and keep going back to work day after day to provide the necessary care to their patients. I personally know lots of healthcare professionals who do deal with, they're humans, right? They deal with everything that you and I do, and they get up and they go to work and they take care of people. But there are some things that we can do during COVID-19, during this outbreak, and I would argue beyond. Self-care strategies, okay? It's never too late to develop some new and healthy habits. Any self-care strategy should be realistic and one that will be sustained over long periods of time, especially after this outbreak is long gone. It should also be simple enough to follow on a daily basis and cover multiple facets of life, like physical, emotional, and spiritual well-being. We have to think of a lot of different things in order to keep ourselves healthy. Self-care is about self-control and can include many of the following behaviors, okay? Work in strong teams of like-minded professionals. Birds of a feather do flock together, particularly during times of crisis. Pace yourself, know your own limits. Monitor for signs and symptoms of your own stress, anxiety, or burnout. Stay connected to your family and friends as much as you possibly can. Take time out for your body to heal and rest and rejuvenate. Nourish and hydrate yourself. Engage in any stress management or relaxation technique that is good for you. Get accurate information from reliable sources on care issues. Do not buy into conspiracy theories. Don't stress or panic unless there's an actual threat. Okay? Sometimes we get ahead of ourselves with things like that. Stay positive and engage in happy self-talk. Focus on what you can control. Accept situations you cannot change. You just can't do everything. Emit a very positive energy for others around you. Be mindful and fully present. Don't forget to be patient, grateful, and hopeful. So, final thoughts. Healthcare professionals have provided great care during times of peace and war, during times of quiet and crisis. Now, they rise to the task of delivering care during a global pandemic and a national crisis. If these heroic providers are going to continue providing high quality of care in the face of COVID-19 and beyond, they will need to be honest with themselves and begin self-care today. I'm Dr. Jim. Stop back for more. Start a new habit today in taking care of yourself.